As you know, we're living in some strange times right now. Scary times. I think for these times right now, it's even scarier for communities of color. Again, we're here to talk about San Antonio as a whole because we're in this together, but at the same time, it seems as though, communities of color are being hit extremely hard with this. The numbers are starting to come out, and it's definitely disproportionate in terms of catching the virus as well as the deaths from the virus. So if we can start out, because I think that's a huge elephant in the room right now as these numbers continue to come out by race and demographics. If you could just take a moment to explain, going forward where we are with this, and kind of allay some fears that maybe the community has. Going forward, how we plan on how you specifically, with what you can control, plan on dealing with this situation to make sure the most vulnerable of the most vulnerable are safe.
Yeah. Well, thank you, Wasim and Doug. Good to see you.
Good
Lisa, thanks for allowing me to join you all today. This is unprecedented. We're in uncharted territory. There's not a playbook that exists for this. This is a pandemic that gripped every corner of the world within the last 3 months, and I don't think anybody really anticipated the magnitude of this so quickly happening to our community. We have a health crisis. We also have an economic crisis as a result. What we do know about the virus is that it's extremely contagious. It seems to be spreading much more rapidly than the flu, and it also has a morbidity rate that's higher than the flu. With respect to how it's affecting communities, we're not a whole lot different we've seen than other cities in Texas and others around the country. It's really indiscriminate. There was a sense that the virus was affecting older people more severely, and that may be true, but that it was affecting mostly people who are older or immune compromised. That's not true. It's actually killing people who are young, able-bodied. There's still a lot left to be learned and researched about the virus. But we do know this: there's no therapeutics, there's no vaccine, there's really no cure. So what we're doing right now is trying to limit the spread of the virus. And that's what's precipitated these measures about social distancing and staying at home. The best way that we can keep the virus from spreading to communities who may end up dying from it is to make sure that they don't get it. And we also do know this: the virus is being spread by people who are asymptomatic. Like, they may feel fine. They may pass like a common cold in terms of affecting them, but they may pass it on to somebody who might fall severely ill or die. In terms of how we're seeing the infection rates, we're seeing our infection rates in terms of ages and demographics fairly similar to the rest of the country. It is disproportionately affecting communities of color. It's also proving fatal disproportionately to older and people with immune compromise. So there's a lot of work that's being done right now to understand why it's impacting communities of color more. But I think there's already good research about that from past epidemics. We know that every crisis, health crisis, impacts disproportionately communities of color, primarily because we have built up a health system that's inequitable. Disadvantaged communities of color have lower access to health care, lower preventative medicine and wellness. And so we're starting to see that. Our health department anticipated that. And so for the last 2.5, 3 weeks, they've been canvassing neighborhoods, they've been canvassing communities to make sure that people are aware of the availability of testing, to spread the information about social distancing practices and things like that. But I think this is going to change this response nationally, and the numbers that we're seeing that are stark are going to change, hopefully, the way American medicine is distributed from here on out. It has to, because we're seeing that the divides, the inequity in our community is only exacerbated by this health crisis. Yeah, absolutely. And I can say that yes, one of the reasons for the canvassing, like you would for anything else, one of the reasons for the specifically going out and targeting communities to make sure they have information about testing is because of that disparity. There's this myth out there that you have to go and you have to have insurance to get a test. When Judge Wolf and I do our nightly briefing, as I'm saying every day, you don't need a primary care provider, you don't need health care, you don't need a health insurance plan to go get a test. We have that pre-approved testing site, and we've even taken away the need to get a doctor's permission. All you have to do is call the hotline, and if you're symptomatic, you're going to get a test. We want to make sure we test everybody. In fact, we want to make sure that we disproportionately test larger numbers in communities that don't have health care because of that lack of access. The food bank has been crushed over the last 3 or 4 weeks.
More than double.
Right. But on a normal day, a normal week in San Antonio before this pandemic hit, they were feeding 60,000 families.
Yeah.
Now we're 120, but 60,000 families
Yeah.
in this community needed food bank relief.
Yeah.
So that tells you where we started, and it's not a good place. But you did mention, lifestyle, fitness, exercise.
And so information about that needs to go out along with healthcare information.
We do. We have a high rate of diabetes in this community, obesity and diabetes, which is one of the reasons why the health experts are predicting we're going to have a higher mortality rate with COVID-19 is because it does affect people with immune compromise are going to have a more difficult time with this virus. And so it is more fatal for people who have underlying conditions, and we have such a high level of diabetes and obesity in this community, it's going to make it more difficult for us, which is why it's so very important for us, like the healthy individuals who think they're invincible from this disease, to also obey these stay at home, because they can transmit it to somebody who it's deadly for. So we're relatively early in the spread of the pandemic, so there's not as much data available. We just don't have as many tests out, and every city in the country is fighting for these tests to do wider assessment. Unfortunately, the state does not track race ethnicity on tests given. We only get it on the test results that are positive. So we've been able to track positive results, but we haven't been able to get the same data from the labs on race ethnicity on just the tests administered, the negative tests.
Well, we can go by zip codes because San Antonio, like most southern cities, has a historical segregation policy. So you do know that certain zip codes will probably encompass a certain group.
Yeah, so we don't have the data by zip code either for the negative tests. But one of the reasons we can anticipate that, we know there's disparities. So that's why they've been doing outreach, the Metro Health, Public Health Authority, with help of the medical schools, students, and other parts, and other medical professionals within the the universities and medical schools have been going directly to the communities to reach out to let people know of the availability of tests.
But I'm saying, how are they going to the community? Because traditionally, people of color do not trust the mainstream media because we've been misled so many times. So I'm asking the question: what is the plan? You said something happened. How are they getting the word out to the community?
They've been canvassing neighborhoods. They've also been targeting the private providers that have that go to when somebody comes into a clinic, whether it's a community care clinic or it's a private provider. We're telling the doctors, let them know these free tests are available. Let folks know if they are symptomatic, call this number. We can get a test administered to them. The United States lost at least a month in being prepared to test and assess communities when there was rhetoric coming out that this is no big deal, that we're going to be prepared for it. And so really starting in March was the push to get tests online. One of the challenges that we have, there's a few challenges. The significant challenges are, number one, the FDA approval process. There's a wild west of tests. You've probably seen at least a dozen tests that come through your inbox. not all of them are accurate. And if we start administering tests that are not accurate, we could exacerbate the problem. So we are trying to buy tests that are already approved by the FDA. We're also validating those tests, meaning we got to test them as soon as we get them in. So we're doing that process, but all the tests that have gone through that process already have been bought up by the federal government, by FEMA, to send to the hot spots. So New York has this huge spike, New Orleans has a huge spike. There's places that are literally on fire because they are overwhelmed in the hospitals. So they're distributing those to where the hot spots are. Unfortunately, there's not enough tests in America to distribute to places like us that want to be preventative. So we're actually going into the market ourselves to buy our own tests, but we have to go through a validation process to make sure that they're going to be accurate before we use them.
I think one of the main problems that we have in this community in terms of this pandemic and trying to stay safe is the ability to truly social distance. You know I'm in a position, I can stay home, I can work from home, right? We do a lot of business every week from home, running the newspaper. But many in our community just can't stay home because their immediate needs need to be met. They are put in a position where they have to choose between, do I go to work and pay my bills and take care of my family, or do I stay home to stay safe?
If you have to choose between your safety and your job, you should choose your safety. And that's one of the reasons why we've from the very start put in safety nets. It is Maslow's hierarchy of needs, and it's not just philosophical anymore. We're all having to deal with it. It's one of the reasons why the food security issue is so front and center right now. Food bank is overrun. So number one, if you are without a paycheck and you have no income coming in anymore because you're trying to keep your family alive, you're not going to lose your home. There's a moratorium on evictions and foreclosures. There's a moratorium on evictions and foreclosures for businesses. And when we come out of this and business starts to ramp up again and the bills have piled up, we're not going to let you be kicked out of your home at that point either. And number one, as mayor, I'm not going to let that happen to people. We are already working on programs for funds. We have $14.2 million now in the risk mitigation fund, which is intended to help with rent payments, even when times were normal. It used to be $1 million, now it's $14 million. We also are working on some legislation that will help create a period of time where everybody can get whole again, so that again, just because income's coming in isn't coming in doesn't mean that bills aren't. So that we don't, we create a landing period where things can start to get ramped up again and people have a way to, ease back into life without having these bills crush them right when business starts up again. This economy won't function if all of a sudden everybody's without a roof over their head. People need to understand that businesses will cease to operate for good if people are still struggling to find food and find shelter. The reason why we put together these working groups is to work intensely on these issues multiple times a day if necessary to get work done quickly. Less talking and more action on food and shelter, social services and safety net, business and unemployment relief. And then the two big groups that are working on finding the resources in the Federal and State Advocacy Committee as well as the Philanthropic Committee that is all local charitable foundation business support. So we have the resources in this community and in the federal and state government to help with relief, and we'll create law in the meantime to make sure that it's utilized appropriately and that people are made whole again as we get out of this. The Workforce Commission is locally trying to bridge that gap and trying to get people signed up, but that is a function that exists outside of the city. What we're trying to do for people who are furloughed and things like that is apply for them. Like for the city organization, some folks were furloughed. We are applying for them, so they don't have to worry about it. We do it in bulk.
our businesses be assured that, with the new stimulus packages that are coming out of Washington that are supposed to be helping Black businesses, that we will be at the table for those, because for so many years, we haven't been at the table for these things.
So I can tell you unequivocally, that is a San Antonio priority. It's also a global priority. In fact, I just read this morning the UN Global Pandemic report that just came out offering global guidance for all these communities that we have to work together to get us out of this. And one of their economic top priorities is small minority enterprises, to make sure, because they are the backbone of our economy. So absolutely, right now we're working on rulemaking with the federal relief packages that are being created to make sure that they flow into small business, minority-owned businesses. We're also working again through that business work group to make sure we align the resources that are available with the businesses in our community. So we obviously have take a zero tolerance policy on racial profiling. I saw that story about the Walmart. It must have been on your website.
Yes.
But I was planning to have a conversation with Chief McManus about that today, to make sure that we've got instructions out to, these are the guidelines on masks, and we've got to be very careful that that officers don't target communities of color because they're doing exactly what we asked them to do. I appreciate it. Well, thanks for allowing me to be part of this. I mean, it's kind of, the social distancing is difficult because I go on the Doug show as much as I can, but that's kind of stopped right now. But we're going to do everything we can to get the information out, and as much as you can distribute, great, word of mouth. But we'll get through this. It's going to be really difficult, but I can pledge to you that my goal is when we do get through this, it's not go back to the same normal that we had before.